Welcome to Big Blend Radio's Quality of Life show. Today, we're excited to welcome back Dr. Jackie-Eubany. She's going to talk about heart health during pregnancy. Dr. Jackie is a board certified cardiologist. She's an electrophysiologist. Yes, I can say that. And she's the author of the best selling book, Women and Heart Disease, The Real Story. You can get it on Amazon, all those great places, but you can also go to her website, womenandheartdiseasebook.com. And if you're in Southern California, you can also visit Dr. Jackie at her Cardiovascular Wellness Institute of Orange County. She's in Orange, California. She also has an office in Irvine. So just go to cvwellnessinstitute.com. And if you want to listen to past interviews and read her articles, you can also go to blendradioandtv.com. But welcome back, Dr. Jackie. How are you?
I'm good. Thanks for having me. It's always a pleasure being here talking to you guys.
Hey, this is cool. We've missed you. It feels like a long time. It's been busy. I know you've been working on your next book, all about the
Yes.
Mediterranean diet. And as soon as you say that, I think of red wine, olives, and feta cheese.
Oh, that sounds great.
I
Yes, it's just been really busy. Yes, I can't wait.
Yeah. So is five ounces of wine still the limit?
Unfortunately, yes, 5 ounces a day.
I want more.
Well, our friends over at Portofino made new silicone cups and they're wider. And then the base has this like line around it because it's like the thicker portion of it. And I emailed her, I said, that's the 5 ounces from Dr. Jackie. She emailed back, no. That's a bit more. But I was just, she was in Greece, with her wine in her bags. And I'm like, okay, you
Nice.
got it. But so
Very
have you
nice.
been able to go out and travel? I know you've been traveling, a lot in the years, but this whole COVID thing's ruined stuff. But have you had some
Yeah.
joy?
No, I haven't traveled internationally because other countries are having, they're
Mm.
dealing with COVID and they have worse numbers than we do. I know I'm vaccinated and all, but I want to just wait till everything calms down. So
Yeah,
internationally, I'm not going anywhere probably this year.
Mm.
Um,
yeah.
so
Well, we got
Which is
vaccinated and we're still
good.
good.
alive. Look at that.
That's awesome.
Yeah, I
Which
was
Hmm.
which
nervous.
vac which vaccine did you
We
get?
got the Johnson & Johnson
Oh,
because,
good.
we travel full time and we thought, okay, we had to get to a place where in case there were side effects
Reactions.
or, we needed more than 5 ounces of wine from doing it, but we got Nancy in the chair to do it, and they were really
Oh,
good.
good.
She didn't pass out. She was very good. But I was worried because of my age group and from, they said about, women in their, mid 40. I'm not saying my age, but they said like, things could happen way later. Nothing happened.
Absolutely.
And, we were nervous about it, but we finally got ourselves out there and did it. And I just want to always bring that up with you because, right now we're still looking at what's going on with this Delta variant. And I don't think it's going to go away that fast. And it seems that if you've got the vaccine, yes, you can die, but the chances are less and that you're not going to get as sick as those who have not had the vaccination. Is that right?
That's absolutely correct. So even with the vaccine, you can still get the virus, but you get a much, much milder case. If you do get it, it's a much milder case. And very, very small percentage of people who are vaccinated even get really sick from it.
Mm,
So
Mm.
that's
yeah.
good, which is
Yeah.
good.
What what amazes me is I know as when going to school in this country that you weren't allowed to go to school unless you had your polio vaccination or shot. There was whooping cough, polio. There was a number of injections and shots, vaccines, whatever, smallpox, typhoid, yellow fever. There was a whole
Hmm.
bunch of them that you had to have before you went to school in this country. And
Hmm.
of course, I was a kid at that time. I just don't remember anybody arguing about it. They just did it.
Yeah, I know. I think, over the years, we haven't seen infectious disease because we've been successful at eradicating all these things with vaccines. So our generation, we haven't seen infectious disease. So we just don't understand the
Mm,
Mm.
importance of vaccination. And we also have all these anti-vaxxers that have put out just horrible informations about vaccines, saying that it causes
Mm.
autism and all these kinds of things. And it's been horrible. The bad information, the fact that this is the first time we're seeing an outbreak in our generation, and not understanding the importance of vaccine. All you have to do is look at the data and see how wonderful vaccines have been. When was the last time you saw somebody with whooping cough or measles? Because we almost successfully eradicated these infections from the populations because everybody got vaccinated. But this generation, we've never seen an infectious disease outbreak. So people just don't get it.
It's like we're starting over.
Yeah.
Well, I think for this country, we look at the countries like India and of course Africa, right? Needing the vaccines and really wanting them. And here we are going, oh no,
I don't think so.
So we've got to kind of balance it out and realize when this is a global situation, and one thing we are seeing from the pandemic is that there's a lot of babies that are being born and on their way to being born because it was kind of like we didn't have electricity for a while. I know out here in Texas, they went through a long time without electricity. So we've got a lot of babies coming. And so I really wanted to touch on this. And we've been talking about motherhood and, parenting has been extra stressful this past year and a half. Suddenly parents are teachers now too. And everything's changing. It's back and forth. So they're also talking about vaccines for kids, right, at this point. So it's a very interesting thing. I wanted to talk to you about moms to be, as soon as they know that, oh, we're pregnant, how does that affect the heart if they already have heart disease or maybe a disease like heart disease, or maybe they talk about having a flutter in your heart or a hole in your heart. So let's just start at the basics. For a woman finds out, oh, I'm going to have a baby. Should you look at heart health just in general, whether or not you have heart disease or diabetes? Is that something that should be part of your concern?
Yeah, absolutely. Actually, let's go back and talk about, women with heart disease who are thinking about getting pregnant. Because if you do have a heart disease and you're thinking about being pregnant, you really should sit down with your doctor and talk about, what you're going to do and talk about medications and things like that. Because there's some medications you can't take because it's harmful to the fetus. So some of the medications we take for conditions like heart failure or hypertension can be harmful. So if you're on one of these medications and you're thinking about getting pregnant, you really should sit down and talk to your doctor because your medications need to be adjusted. You need to stop those medications and take the ones that are better for pregnancy. So yes, heart condition, your heart health is very important to take into consideration when you get pregnant.
So what about if you have hypertension or high blood pressure? Because we're seeing it happen in the younger generation, aren't we, these days?
Yeah. So if you are hypertensive or have a diagnosis of hypertension on your medications, definitely talk to your physician before you get pregnant, just to make sure you're not on one of those medications that are bad for the fetus. And once your medications get change to medications that are more, fetal friendly, then you can go ahead and proceed with pregnancy. And it's always important to keep your blood pressure very controlled while you're pregnant. During pregnancy, you have an increase in blood volume because of the pregnancy, of course. And as a result of that, your blood pressure can sometimes, be even more difficult to control.
Oh, wow.
So it's very important to maintain your normal blood pressure or take your medications as prescribed to keep your blood pressure at an acceptable level during pregnancy.
There's a lot of stress, when, I don't know if I'm thinking back, is there more stress while you're pregnant or right after you have the child?
Well, the
this is a lifelong stress.
There's a lot of stress.
And a strain on the pocketbook. But a lot of joy for the heart. There's a lot of joy for the heart too, right?
Yes. But
it's a lot of strain on the heart to support two people. So it's a lot of strain. I mean, it's amazing. It's a miracle, I think, the whole aspect of pregnancy. But yeah, your heart is now dealing with a lot of blood volume. you become anemic because your blood count is low, and so your heart's working hard to pump oxygen, nutrients, not just to you. Now it has somebody else that it's supporting.
Exactly.
So it's good. It's okay if you have a normal heart and you have no issues, but if you do have cardiac issues, it's definitely important to take care of those and see your doctor before and all throughout pregnancy.
So
And
does
now
that,
they have
oh,
high
sorry.
risk, doctors that deal with high risk pregnancy. So if you have any medical or cardiac conditions, or you're elderly and advanced maternal age is over 30, which is ridiculous. But if you have any cardiac problems, then they refer you to these specialists that deal with
So
advanced pregnancy. Yeah.
advanced. That's what I was going to go. Is like if you're older. So 30 is now you're on the elder side of giving birth.
Yeah, we're supposed to be giving birth,
It's not happening with me,
teenagers
man.
to 20s. Yes, in our generation, we go to school and we work and all that. So a lot of women start thinking about getting pregnant much later. So we
Exactly.
see a lot of
And
complications as a result.
we're living a lot longer.
Yes, and we're living longer.
So, we think, oh, well, I can wait till my 40s or 50s. No.
Yeah, and those women end up with using a lot of help with IV fertilization, in vitro fertilization, and medications and all that stuff.
Okay, and what about weight? I mean, if you're overweight, and because that's something I've got friends who want to have a baby and maybe overweight, and that could be part of a condition or something like that, and maybe they're in their 30s, they are in their, ooh, I didn't know the 30 thing, man. That just sucks.
Yeah, see?
Doesn't
That's
it
like,
though?
well, I know, because listen, it's like 80s music is now classic rock. I object.
I know.
It's just stop it.
I know.
It's just stop it. But so does weight play an issue in pregnancy with your heart?
Yeah, because when you get pregnant, you're going to gain a whole lot more weight.
A whole lot more. A whole bunch.
And it's not healthy for the heart, again, because the heart's working really hard to support you and the baby. And so if you have a heart condition and you're overweight and you get pregnant, it just causes a lot of stress. And it's just definitely important for you to see your doctor on a regular basis, to get checkup and to make sure you're following the advice of your doctor, taking the medications you're supposed to take, and just be really hyper vigilant about your medical condition and your medical state.
And understand, because maybe the medication's not working even the way you think it should. Is that something that, like, should women start writing things down, like, this is how I feel today, like have a medical journal?
Yeah, absolutely. And monitoring your blood pressures at home, writing them down, taking them to your doctor so that they can recognize when, you either need more medications or less medications. It helps them adjust their medications accordingly. And if you're having symptoms, you need to report that.
How come when you get pregnant, you gain like 20, 30 pounds? And then the child comes out and it's maybe 5, 6, 7 pounds. What the heck? What's up with that?
The hormones, all the hormones in pregnancy make you hungry, and you just eat more than.
No, it's wrong. It's wrong.
It's not baby.
I thought she was going to come out and I'd be skinny.
I know, exactly.
It's like the watermelon just,
I
passed
know.
right
and
through.
Then here comes this little thing. I'm like, what?
Exactly. Yeah. So it's very difficult with the hormones, being hungry all the time. And it's not, you're not eating you're eating for yourself and
you're
a tiny little
for
baby.
Two. And
that's what people say, but not really. You're not eating for two adults.
See, that's right.
Oh,
Here's
that's
your
a good
spoon
point.
full for the baby, right?
Okay, then your bite, and then the rest is for me.
But what happens if you're underweight as an individual? Does that affect your heart? And is that something to worry about?
Depends on if you're severely underweight, you probably cannot get pregnant, because our bodies have a way of just preventing, us from getting into harm. Because if you're underweight, you probably can't support another, a baby, and you probably will have a difficult time getting pregnant. Like if you were, weighed less than 70, 80 pounds and you're malnourished and you're, you're actually doing things that you shouldn't be doing to be that skinny. That's also a lot of stress on the body. So you're not able to get pregnant. But if it's a normal weight, if it's a normal 70 pounds, is not normal. But if you're like naturally lean, then it shouldn't be a problem. It shouldn't be a
That
problem
doesn't
getting
run in
pregnant.
our family.
No.
It doesn't run in mine either.
Darn it. But it is important to talk about that, because I think a lot of times when we talk about weight issues, we always think it's overweight, and that's not necessarily true. There's a lot of women running around that are underweight, and it's there's all kinds of reasons, right? Anemia runs with it too. And so the diabetes thing I wanted to touch on, because that's something that I've read with, just with friends and everything, is you've talked about diabetes on the show, how that's so connected to heart disease as well. So when a woman is pregnant and has diabetes, should she be seeing a cardiologist or still just your normal physician? What happens with that?
If she's pregnant with diabetes, she'll probably be seeing the high risk OBGYN doctor that deals with stuff like that. And if she also has a primary care doctor, she can see a primary care doctor for adjustments in medications. So yes, diabetes is equivalent to having a heart attack. It's really destructive on the heart. Also, the diabetic women who are pregnant tend to have bigger babies because all the hormones are growth hormones, and it can make your baby bigger. But overall, you should make sure you're following your doctor's orders, taking your medications as prescribed, checking your blood sugars as frequently as your doctor is asking you to do. Just following orders will help quite a bit.
And so what about the baby itself? Is that something that, as the baby, about the baby? I know there's always like, oh, let's go listen to the heartbeat, right? So heart plays a role immediately. I mean, everything is like when lights are out, the heart's out. The lights are out, I should say. So lights are on when the heartbeat's going. But when it comes to the baby's health, is that something that you do as a cardiologist? Will check in on a baby's heart, or what is this murmur and hole in the heart thing that people need to watch out for? It sounds like a rock band.
So they actually there's a specialty of cardiologists called pediatric cardiologists that deal with, infants and babies. So I don't come into play until they become adults. Okay. So in terms of murmurs, I guess we could say two types of murmur. There's the what we call innocent murmur, versus the bad murmur. So the innocent murmur is just blood going through your valves. You have 4 valves in the heart, and the blood moves forward. So it's like it opens, one valve opens, blood goes through it, and it shuts. And then the other valve opens. So that's just how blood flows through the heart. Sometimes you can actually hear this. It just sounds like a light murmur as the blood is either going forward or slightly backwards. And those innocent murmurs, you don't do anything about. Most people have them, and that's not a big deal. Now, the bad murmurs signify a problem with the valves itself. So these valves open and close, like I say, to get blood moving forward and out of the body. So these valves can either become what we call stenotic, or they become tight. They can't open very well. Or they're what we call regurgitant or floppy, and they don't close very well. So if they don't open very well, you can't get a lot of blood going forward. And if they don't close very well, all the blood is going backwards. So the blood going backwards can, cause fluid accumulation in your lung, and put you into heart failure. And when it's tight and it's not flowing forward, you have problems with either oxygenating organs in the forward direction, or it just not backing up into your lungs. So if you're pregnant, if you have one of these conditions, because a lot of times you can be born with these conditions. If you have these conditions, and you're thinking about pregnant, you really need to see a cardiologist, and they have to work with you through your pregnancy, and especially during delivery, to make sure you don't have complications for yourself and for your baby. Because like I said, when you're pregnant, your blood volume goes up higher. So you have this heart with the valves that are either too tight, not opening well, or floppy, and you have a whole lot more fluid coming through. It can definitely pose a problem for your health and your baby's health. So it's very important to see your doctor.
It sounds like you're playing the trumpet, and then like the good murmurs, like the trumpet sounds good, and then the bad trumpet playing in the apartment next door sound.
Yeah,
that's kind of what it sounds like.
Exactly. It's true. It's lighter. The normal ones sound lighter, and the bad ones are harsh. blood trying to
really?
go through a little tube, and they're harsher and, louder. And so, yeah, so you
Wow.
can tell the difference by listening to them.
Oh
Wow.
man, I want to record that stuff. That could be used in music. Come on. It could be, I know I'm weird, but
Wow.
now the murmur thing, like you're saying, you could be born with that. Would that be something genetic, or that's just how you were made?
Yeah, it's just if it's just something, you just hear blood flowing through the valves. And on occasion the valves leak back a little bit, and that's just not a problem. So you're born with it, and it poses no significant clinical problems. So a lot of people have it, and it's not a problem. So it could either be like if you're anemic or something like that, your heart's pumping harder to get oxygen forward. So you might hear the whooshing sound a little bit more, just whoosh, 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 and that's just the blood flow, and it's not a problem. No clinical significance.
So people with tinnitus say they can hear their blood rushing back and forth. Is that what they're actually hearing? Do you know?
Some people do. So I can hear my heart beating. Like sometimes when I sleep a certain way, I can hear. I have a murmur, and I can hear it. So yeah, some people can hear it, and people. I get that complaint. Doc patients coming in and saying, "Oh, I can hear my heart. Is there something wrong?" No, there's nothing wrong. You can just hear it.
Not exactly the heart. They say they hear the blood rushing. No,
probably not. No, probably not. No. Okay. You can't hear the blood going through your veins. No.
I wonder what they're listening to.
I wonder what they're listening to.
We're going to call Bill Shatner.
Exactly.
Sorry, I'm playing with dogs.
I know, I'm playing with a cat.
As people know, we travel and we hang out with dogs as we travel, and the dog decided to come under the desk and turn things off. We're still here. Well, he was into the murmur. He's quite a musical dog.
I know. He's interested. He wants to learn more about cardiac murmurs.
Yes, he does.
So when a woman's going through pregnancy, so they're checked. So the heartbeat of the baby is a big deal to start knowing at that point if they have a murmur. Is the murmur connected to the hole in the heart thing?
For the baby, we just want to hear a heartbeat. Babies, whereas adults, our normal heartbeat is anywhere from 60 to 100. Babies, their heart is beating at like almost 200 beats a minute. So it's going really fast. So it's going really fast. So you just want to hear it, and you want to make sure it's going fast. Now the hole in the heart, it's babies in utero, we all have a hole in our heart, because this hole is the way that mothers pass on nutrients to the baby. So you have a hole that, because the baby's lungs are not working, so this hole bypasses oxygen from the right side of the heart to the left side of the heart without going through the lung. So we all are born with this hole, but as soon as you're born, the hole should close as you take a deep breath and your lungs expand. It closes the hole. But in 25% of that's in the normal case. In 25% of the population, the hole is there. And we call it a PFO, a patent foramen ovale, and it generally doesn't have any clinical significance. But now there are holes that shouldn't be there. For example, if that hole didn't form well, when you have malformations of the heart, you have what we call an ASD, a hole that it just got big because the heart didn't form the way it's supposed to form. So it formed and it left a big hole in the heart. Now that's bad. It's called what we call, if it's on the top chamber, it's called the ASD. And if it's the bottom chamber, it's called the VSCs. And depending on the size of it and depending on your symptoms, you might need it repaired as a baby. Most of the time you need it repaired as a baby, or if it's small enough that they follow you clinically to adulthood.
Wow. We're learning a whole bunch of new stuff, man. Dr. Jackie, these are some big words. I'm just going to talk about, you got the top hole.
But there's all that songwriters who say they have a hole in their heart. I wonder.
No.
So that's an emotional. So I didn't talk about the emotional hole in the heart. That's a complete.
So what about like diet, because you always talk about, 80% of women's death, 80%, it's heart disease. It's heart related, So we need to think about, pregnant mom going, she's out there and hungry. So maybe eating a little bit more chocolate or whatever, the peanut butter and the pickles, which I love. And I'm not pregnant. I've always loved peanut butter and pickles, man. Come on. But when
Okay.
when you think about heart health, it's something we've talked about, women, we're already at that point where we have these naughty habits that we shouldn't be eating these certain things or having more than that 5 ounce of wine. So part of the idea of what I wanted to talk about is also motherhood, thinking about heart health for, I mean, obviously for boys too, the kids, both men and, male and female, but it's something to think about at the very beginning, right? So that those habits are in place.
Absolutely. Absolutely. Yeah, just because you're pregnant, it's not, it shouldn't be a license to eat whatever you want.
Come on.
I don't, you're not supposed to drink at all when you're pregnant, right?
Alcohol? No, no, we know now. We didn't know this
I thought
back.
they said you could have one sip here and there.
No, not especially in the first trimester when the baby's organs are forming. You probably should just not
I saw a
drink
woman
any.
smoking, full on
Oh my
pregnant,
goodness.
smoking the other day. And I looked at, I was like, I haven't seen someone do that in years. Like, I mean, years. I was
I'm pregnant? Wow.
like,
I know.
I was
That's
like,
crazy.
I haven't
That
seen
is
that
crazy.
for
That's
like,
crazy.
I just kind of
That's just asking for trouble.
and I was taking photos of, it was when we were in Oregon, Nancy, and we were taking all these photos of downtown, and I'm like, do I photograph that?
No.
Just put it as like, don't be this person. But I just kind of stopped in my tracks because, I haven't seen
Yeah,
that
because we know so much
Yeah.
now about
Yeah.
the harmful effects of cigarettes on a baby. I
Yeah,
just
that's
can't imagine why
Wow.
anybody would do that,
Well,
but
what about vaping? Everyone's doing this vaping thing.
it's the
I've heard
same
some bad
thing.
things.
Same thing. It
You
is.
shouldn't, yeah, exactly. You shouldn't do any of that. Nicotine is bad for the baby. The baby is forming all its organs. It's very important that it's getting the proper nutrients and oxygen it needs. When you introduce all these things, you cause, brain issues with the baby where the baby is slow, and I don't think anybody would intentionally want to harm their child.
No.
So not a good idea.
But heart
Well,
health and getting them on the right food from the beginning,
well,
like eating heart healthy food is good.
Eating heart healthy is always good.
If you're really addicted to anything, you probably should really reconsider having a child at all, because the stress of it is going to make you even worse.
Yeah, no, absolutely.
I mean, there really is a lot of stress involved in having a child during the pregnancy, after the birth, and then the first so many years. There's a lot of stress. So if you're already addicted to something, you better clear that up first.
As much as you can.
I would agree with that.
Yes.
So there's some women who are, heavy smokers, and when they get pregnant, sometimes their physicians would recommend like a nicotine patch, because, nicotine is just extremely addictive.
Yeah.
And you would much rather they have the nicotine patch than the cigarette. The cigarette has about 6,000 chemicals. Some of them cause cancer and all these things. When you burn that's so much worse for you. So if you're one of those that is just completely addicted to smoking, and there's no way that you can, quit smoking if you find yourself pregnant, sometimes maybe just a patch to help with the nicotine craving, because at least that's controlled. We know what it is and we control the amounts. And that'd be better than just, smoking a cigarette with all the chemicals and all the carcinogens. That would be a problem in a baby that's just forming in your stomach.
I know you've been on the show talking about drugs, and you could do them when you're a teenager or in your 20s and not do them. And then all of a sudden later in life, it gets you and you have heart disease. You've talked about that, cocaine, heroin.
Absolutely.
You think you've kicked this, party drug for a while, and then all of a sudden it sneaks back. Do you think cigarettes are like that?
Yeah, absolutely. Because, if you stop smoking, your lungs do heal, but it doesn't heal 100%. You can still develop lung cancer later in life.
Wow. That's amazing.
And COPD, that can still happen even when you smoke. Actually, a friend of mine was just telling me her father, who was a heavy smoker in his 20s, then quit 30s, 40s, 50s, then developed cancer in the 60s and passed away, lung cancer. So yeah, you can still develop it.
Yeah, I think, for a lot of people in the entertainment world who have a lot of parties and things like that, when something like a pandemic like COVID comes around, even though they have kicked the habits that they may have had, they seem to be more vulnerable to pandemics and diseases that other people you might be able to not get because you're wearing a mask, you got the vaccine. But those, I think when you've weakened your body, even if it's 20, 30 years down the road.
Absolutely.
Yeah, I think you may not see or feel the damage that you've done, but I think it's there.
Yeah, absolutely. There are always residual effects of bad behavior.
But you can still try and fix yourself as best. You don't stay there. That's what Dr. Jackie's always like. You still go eat your celery.
Yeah.
That's right. Eat your celery.
Eat your celery. It's good for you. It's good for your heart. Eat your broccoli and your spinach.
Okay. Celery is supposed to make you lose weight.
Well, listen, we can reverse these effects, but if you've been naughty at a young age, then but you can reverse a lot of it, right?
You can reverse a lot of it.
I don't want people to think like, hey, no.
Yeah, absolutely. You can reverse a lot of it, but unfortunately it's not 100%. There's still a small fraction of people that will end up with health issues as a result.
Yeah. Well, there it is, everybody. Be careful what you do as a rock and roll band.
Yeah.
It's true, actually. It's really true. Well, Dr. Jackie, thank you as always. Good information. Everyone, Women and Heart Disease, a real story. Go get it. You can go to Women and Heart Disease, the book, and go get it there. Amazon, all those great places. And of course, as I was saying, you can listen to Dr. Jackie on blendradioandtv.com. And of course, keep up with us at bigblendradio.com. And we air Monday through Friday. So thank you so much, Dr. Jackie.
Yeah, thanks, Dr. Jackie.
Thank you for having me. It's always a pleasure talking with you, ladies.